here are some of the specific CBT methods and in pain management. And by the way, CBT for pain management is generally short term. Again, these are not things, again, unlike the kind of the medications where those are supposed to be short term as well and they end up being very long term. What I find with folks when things are successful, and they can be successful in a kind of shorter term, and so I have many folks who come in, who have come in intensively for a few months or so, and then they're doing better, and they come back, once every other month, or sometimes even just a couple times a year for just kind of CBT checkups. But I've definitely had success with people, doing CBT in kind of a short-term format. So functional restoration is kind of a formal modality that wraps CBT. These are my words, not the authors. That kind of wraps CBT in a kind of an integrated pain management model. I have a video that I thought was I think is really good. A few slides down, so you'll see that at the end of this article. It's been around for a few decades. Has been widely used in the VA. And has been well published and a lot of evidence to support it. There's some specific programs that are cited by the authors as particularly good at functional restoration. I can tell you, I have a client who is still comes to me, who was referred to me by this program. She went to this program and then was referred to me as a part of her aftercare plan. And she did what she described. She had a very good experience there and spoke very highly of it. Now, the downside is that these are expensive and hard to get into. I can tell you, in the case of the same person that I'm thinking of, it took her a year or so of can't think of a better word, fighting with the insurance company, with her health plan, to get them to authorize it. They eventually did, but with a lot of extended amount of time on the phone and writing letters and things of that nature beforehand, and in fact, even she reported having some initial denials for different parts of the care, even during it. So these can be difficult to access, as good as they are. So as I was saying, the VA has made use of the functional restoration model, as has the military. And in 2003, the Department of Defense actually launched a formal program around functional restoration called FORT. We know our government agencies love their creative acronyms. So you have Functional Occupational Restoration Treatment Program, and has had some great success. And and again, we talk about things that are not just for the good in terms of the human condition, but we have economic aspects. And then here, in this data point here, we can say that, hey, this functional restoration model actually supports national security, right? Because they were able to reduce those who needed medical discharge. So actually improving our readiness, which improves our national security. So in the case of this functional restoration program with our military, it's made a contribution towards our readiness, strength of our military, and our national security, as well as economic and human benefit. So I think you'll find this video provides a great illustration of functional restoration. Follows a number of people in this, I think, 8 or 10 minute video, and their process of chronic pain management and to a certain extent recovery through the functional restoration model. I really like it. It's a few years old, but it's a really great video, and hope you enjoy it.
For 3.5 years, there was a lot of things I couldn't do, and I was depressed. I didn't realize how badly I was. I didn't realize how bad of shape I was in.
Time gets away from you so fast, just because you're doing the same thing every day. You get up, you go to the couch, you find your favorite spot. You can't really do anything else. Your friends give you a call to go play golf or go camping, fishing, and you can't, you're in pain. And it affects your life.
I'm on this medication and I'm still having lots of pain because the medication does lead to pain. After you're used to it, then you start having the withdrawal pain. And I was definitely in that category.
Chronic pain is a chronic problem in our country. Over 100 million adult Americans are affected, and it's the #1 reason why people are out of work. Plus, the cost is astronomical. The chronic pain price tag is about $635 billion a year in medical expenses. That's more than cancer, heart disease, and diabetes combined. That's why it's so important to address the treatment of chronic pain patients. Traditional care most times isn't enough. Functional restoration programs are the answer because these programs treat every aspect of a chronic pain patient on both the physical and emotional level, and it's all done under one roof.
We see so many people with chronic pain, and it doesn't matter how they got it, whether it was from an auto accident or work injury or whatever. Some people can deal with their chronic pain and others can't and end up being couch potatoes. And the idea with this program, when I first got introduced, is that they want to get them to have a life again.
Pain, especially when it becomes a chronic entity, is a pathologic state. It affects multiple aspects of a patient's life, both physically and emotionally. And when you get to that point, it truly needs a multidisciplinary approach to effectively treat the pain.
It was like falling into safe hands. I was watching a movie the other day and the Navy was coming in to rescue somebody, and I thought, that's how I felt when I went to that program, because I was being absolutely surrounded with love, and they had every resource in the world for me, whatever I needed.
Functional restoration programs typically require a 6-week outpatient commitment. Those 6 weeks are made up of full days filled with physical therapy, psychotherapy, yoga, massage, pain management, nutrition, and group therapy.
I just followed the program blindly. So they gave me some medicine that would eliminate any withdrawal symptoms, that type of thing I would have, and it worked fine. It worked within a day, so I didn't know the difference, except I felt better almost immediately. I think it is almost a miracle. They work your butt off here. The physical therapy is tough. It's 2.5 hours a day, so you're working hard. You meet with a psychologist every day and a medical doctor, at least once a week. And so they give you a full day.
It addressed all aspects of my life, and not just the physical therapy side, but the psychological, keeping you motivated, the doctor helping with the meds, and it's really the whole program. And in fact, they even had yoga, which kind of surprised a big guy like me doing yoga, and I was really surprised at it. It did a lot of good for me.
Those 6 weeks are an intense therapy that you just cannot duplicate in, quote, the outside world, where we try to piece this together with different specialties. A true functional restoration program, everything is in-house, and you can use the resources immediately as they're needed.
Chronic pain is a biopsychosocial condition and is best treated by addressing each component of the condition simultaneously, with a huge emphasis on decreasing the need for prescription drugs, which many chronic pain patients become addicted to, and that in itself is a chronic problem on many levels. Financially, when looking at workers' compensation, the average claim cost is $13,000 without prescription narcotics. With them, the average claim cost jumps to $117,000. And more importantly, there are now more deaths in the United States caused by prescription drug overdoses than car accidents.
Having been told I had such a problem and then going to a program that was so ready for handling somebody to get off medication and deal with chronic pain. And in the long term, I mean, I exercise a lot now, but that's the trick.
And when you stop the cycle of that, you find out you're actually fine without it. And that's a shock.
Some patients, we might never get off of all their pain medication, but if we can reduce it from taking 10 or more a day down to 1 or 2, and they can actually take care of themselves and get out and go shopping sometimes is a big thing because they can't walk, and then they learn to adjust. It's like a miracle for them.
A functional restoration program means to me the ability to get out and enjoy life. It means getting out and having, experiencing life in the way that I was used to before.
A functional restoration program to me is the ultimate in humanity and caring for individuals, mentally, physically, and seeing that they come out as a productive human. And so often people are left on medications and they are not a productive person. They simply wilt away and die.
Functional restoration program to me is restoring you to what you used to be before your accident or illness.